Hello, guys. So I did change, and you guys still have the first portion that I already put on. I was afraid that it wasn't gonna go all the way through, or there was going to be some kind of a uh, voice issue. So that's why I cut the first one short. But you guys can get information from the first one. Okay. So these are the books. I just dropped these up first. And remember what I told you guys? You can get these books from Kindle. Okay. CPT you also can get from Kindle. That video that I just did before this, you can see that. Okay. So this one is Hicks Picks Level 2. And you guys know these are the books that we are working on. I put the ISBN number down below so you guys know which book that you want to get. Okay. So don't forget, I numbered these chats to make sure that you get what you need. Okay. So let's kind of just move on real quick. You guys have the schedule. The schedule just tells you what we're going to do in this classroom. Here's the schedule for week 15. I'm going to take this down so you can see that schedule. This is for week 15. Today, Tuesday, we're going over what we did yesterday, and then we're going to go over the workbook. When you guys get your workbook, you will see that the workbook is more geared towards workbook is more geared towards activity. So that's what we're going to do today, activity. Okay, so we're not going to keep it up too long. Eventually, I'm pretty sure they give me a strike for showing too much of Fordney's book, but it's educational. So if they do, they do. If they don't, they don't. What I'm going to do is just I'm going to share my screen with you. Share my screen. Fordney. Okay, so we yesterday we went over the chapter 5, and let's get this out the way. Copied. All right, so I'm just throwing this up here because we're just kind of showing what we went over and what we kind of left off with for that video we did like about 10 minutes ago. So we did revenue cycle management yesterday. We did session 17, session 14. We did chapter 5. Unit and 5 to me is the same thing. I'm just saying chapter 5, but generally this is really chapter 17 and chapter 18. Okay, so we finished that part, and all I'm going to do is drop up the other session. It wasn't that big, but it still was enough in there. So let's go to 6, healthcare facility. This is what we did yesterday, and this was chapters 19 and 20. So you guys should be still working on this because we're doing the review today. Okay, and this is the reading material. That's your reading material. So what we're going to go over today is actually the workbook. So remember, if you guys need more time, you need more time. Take as much time as you want to. You can backtrack on this and look at whatever you need to. So remember, this chapter, healthcare facilities, coincides with all the rest of the chapters. I just want to show you this real quick. I just want to show you the objectives real quick so you know which objectives you're going to write down. So here they are. And the objectives is what you're going to learn in this book. So in that book, this is what you should be learning. Okay. So we're just going to take that down real quick. And then I'll go back and I'm going to get the workbook. Some of you who want to get the workbook, let me put the ISBN number for this workbook because I put the ISBN number for the reading material, but I have given you this before. I'm going to give it to you right now. Let's put it up. There it is. That's the ISBN. Okay. So make sure you take heed to that when you're getting ready to do your book search. So when you're getting ready to do your book search, you know which book that you actually want to get. Go to elsevier.com. I'll put that link also below. And you can also go to Amazon and get those books. Okay. So just make sure you use your time wisely when you are studying. Okay. So yesterday we did the 5 and 6. Here we are on the blue plan, private insurance, managed care, which we did some of the other day. In the workbook, you will just see a different type of layout than the reading material because this is where you're really going to get your exercises from. Okay, and these are your key terms: would be auxiliary services, Blue Cross, capitation, co-insurance, concurrent review, co-payment. And this is a very important section. Not that all of it is actually, all of it is important, but some of these sections that are in here, you must know in medical insurance billing. So just kind of be precarious when you are learning these things, because you will use them on the job. You will use them on a job, and there's going to be times when you might be the only biller there. If you work in a physician office, it may be two of you guys. So you guys, it might be a little bit hard to start at the first, but at the front by yourself. But they will help you. Okay, these books are the books that you need to get started with. You can put these words on index cards. Okay, put those words on index cards, because they're going to help you. And because we're kind of moving fast through this whole chapter, um, we want you to make sure you make those index cards for study. Okay, so these index cards will have this information on here. The PPO, most definitely for study. Um, Copay, EPO, FFS, HMO, PCP, those type of things. Okay. So you guys know I can't read the whole thing, but I can show you a thing or two when we're in here for like a few seconds. Okay. So here's your study outline. Private health insurance, managed care systems. That's why this is such a good book for you. Anybody who has not done medical insurance billing before, this book is literally your go-to. Managed care system, utilization management, pre-authorization, concurrent reviews, retrospective reviews. You cannot go wrong with this book. And the guidance that you need is right here. Uh, Revenue cycle management, deductibles, payment modules. If you guys have a question, make sure you email me or message me. So you guys that are on YouTube, like I said, you don't have the regular test that they have at Sapphire, but you still can contact me in regards to a test that you might be taking. What if you're getting ready to take your CPC? Don't forget to go on www.aapc.com. There you go to. Okay, they have a list of what's going to be on that test. When you get your ICD-10 book, hold on, I'm talking to the screen. When you get your ICD-10 book, I would prefer that you get the AAPC version, because see, they're showing us the AMA version. I'm gonna click on it right now. So they're showing us. Get back. They're showing us this version. So this is the one that I'm seeing in Kindle, which is fine. Do I prefer the AAPC? Yes, I prefer the AAPC. Don't forget the guidelines are also in there. And you remember what I said? You can you can get like the first couple of, I don't know, maybe 50, 60 to 100 pages in here. Look at this. The diseases are, everything is in there. The index, the tablet is in there. Kindle, last year we went over this in Sapphire. I had no idea Kindle had all those books in there. I had no idea that they had coding books in there. I had no idea that they allow you to look at 100 pages. So do not sleep on the Kindle for your books, okay? That's what we did in the classroom. So here, this is what we are reviewing. Make sure that you get your index cards. If you are not sure of something, if you forget something, if you need to send me a message, send me a message. Miss Lambert, how much of this do I have to study? Miss Lambert, XYZ. Okay, so I'm going to remove this now. So we are in the workbook, and I want you guys to see the workbook is the same as what we did before. We are in chapter 5 of the workbook. Let me drop this down so I can see what else is in there. So it tells you what's in the book. So you're going to be working on key terms, abbreviations, performance objectives, study outline. So the first thing we're going to do is review questions. An insurance plan requires the insured to pay a fixed monthly premium. The insurance that will pay the healthcare organization for services each time the service is rendered is referred to as. So those are going to be your fill in the blank. That's your fill in the blank right there, okay? That's your fill in the blank. So yes, you're going to need to do all of the work. I don't need you to sit in front of the computer to look at me to do this work, okay? I'm putting you in the right place. Okay, you can do the work on your own. There's times when, yes, you probably need to be, in a one-on-one with me, which is fine because we can do one-on-one. I don't have a problem with that. With YouTube, I have to figure out a way how to do it with Zoom, and it might be 15 to 20 of y'all, and we can probably do it on here. But again, we got to get the views up. We got to get the views up. So make sure, tell your friends, tell your coworkers, tell your hospital friends, y'all need to come to Miss Lisa YouTube. Now y'all got me calling me Miss Lisa. Y'all know I hate Miss Lisa, but I'm gonna go with that to just get y'all in this classroom. So we need you. So make sure you guys subscribe to my channel. Okay, subscribe to my channel and tell your friends. And don't forget that Q&A book is in there if you don't know anything about medical insurance billing. Okay, so here we're going to look at the multiple choice. Let's do the first one. Okay, I'm going to where we at. I can show you real quick, and then we can kind of come down because we can't really have it up more than a few seconds. Okay, a type of managed care plan regulated. Understand insurance statutes that combine features of HMOs and PPOs and requires that employees agree not to contract with any other plan is known as. That's why I love this book. She has everything in this book that you need to get through on any exam. You just have to know how to retain the information. Retain the information. When the primary care physician informs the patient and telephones the referring physician that the patient is being referred for an appointment, it is called. Nine. I'm not telling you you're supposed to be reading this, okay? We're just kind of going through. Okay, so true or false? Private health insurance. Private health insurances are government-sponsored programs. True or false? Value-based reimbursement programs reward healthcare providers with incentive payments for the quality of care they provide. True or false? So again, in your book, um, if you get a physical book, of course you can write in your book. If you have an ebook like I do, I have the ebooks. You can use a piece of paper. You can just get a notebook and write what you need in there. Like something like this, you can write in there. I don't know what that is. You can that's TT's. Okay, so it ain't nothing. It's just scribble scrap I got on there. So again, ebooks they're a little bit hard, but I like to eat. Look, I can go downstairs. I have my coffee. I take this with me. I can hit the CPT book. I can hit the CPC guidelines. I can switch it without lugging a whole bunch of books. And that's the reason why I made the program like that. SapphireCoding.com. Don't forget. And you guys can get the courses from me. You can get the courses from me. If you want those outline courses, we can absolutely do those courses. In this course, you have to have the workbook. Especially those of you who are in YouTube, you must have the workbook because that's how you're going to be able to retain. Okay, you just need to have the workbook. I'm just going to drop this up real quick. These books do not have to be the new books. So you guys know I say that every chat. That's what I say. They don't have to be the new books. You can get the older books like the 2013, 2013, 2000 and 2016 or 17. They're pretty much the same thing. But don't go too far back. They probably don't have them. But if you go to thrift, you'll be right there. The only thing in the book is probably the pages probably changed or something like that. Okay, because when you take your test, you're going to need some type of medical insurance billing information to help you pass that portion. So there'll be sections, on your CPC, depending on who depending on which one you're going to do. Okay, so your open and closes first, and your big cases will be second. If you're not going to move on to your CPC, that's fine. Just steadfast on your medical insurance billing and coding. Okay, so again, all books will have the same type of format: key terms and abbreviations, objectives, and your study line. Okay. So this book also has a task for you that has to do with the managed care plan or authorization request. So sometimes you might be working in the authorization department and you might have to get an authorization. and you're not familiar how to do it, all you need to know is the basics of how to get an authorization. Every facility will show you what their protocol is. I mean, none of us is perfect by all means. I mean, you can do something 25 years ago. You're not going to remember it and be keen like that. What if you decide to go back and work in the facility from working at the bar or working, from a facility to a physician office? Everything is different. Everything is different. What I would suggest you do is just once you finish your course, let's say you're doing the medical insurance billing. Once you finish medical insurance billing, which I'm sure we'll be finished with medical insurance billing next week. Is this our second week on medical insurance billing? This class for you guys should only be 3 weeks. If you are still in it, that's fine. I haven't done the schedule for next week yet, but we will do the schedule for next week. Your workbook must be done. So the reading of the material, we're mostly doing it in the classroom. We're mostly doing it in the let me show you this. We're doing it in the classroom. But you guys let me know if you want more of that. I'll see what we can do. This is pretty much like a new patient form. This is an intake sheet. That's just a quickie. That's what's in the book, and you guys can see all this stuff that's in that book. It's so much stuff that's in the book that you guys can learn from. I just can't go over everything because of a copyright issue. Okay, but again, make sure that the provider is completing those things. These are directions: complete the treatment authorization form for this patient. That's going to be a work assignment for you guys. Okay, so again, this is why we have um, all the way up until Friday, to complete this. You guys give me some feedback as to what you think about the classes that we are doing. If we can do them better, if let me know what time. Most people are not home right now. I already know that. But I want to do it now because I needed to drop early because I had the extra 10 or 15 minutes because it looks like I'm going over my hour. But retrospect to that, you guys remember when I did it at 9 o'clock? You guys were all over the place, but I did it at 9 o'clock on Saturday. So if you guys want me to do 9 o'clock on Saturday, and we can still do 6 o'clock, but let me know if you like 9 o'clock better than 6 o'clock. Okay. Okay. So that chapter is done. Assignments, obtain authorization. We just did that. We just kind of went through that. Okay, so let's go ahead and go down to Medicare. So your chapter 6 in here is Medicare. You remember what I said? Your complexity on this one is different, but it's the same thing that you're going to do here. These are the things that they want you to look at. Okay, I haven't switched it yet. I'm going to switch it in a minute. Let me see. Key terms. We're on Medicare. Okay, let's hit Medicare key terms. Okay, so this is important for this and also for your test. Okay, make sure you get this down. Okay, the Medicare key terms adjustment, advanced beneficiary notice, non-coverage, advanced alternative payment model. I'm not going to read all of them. Crossover claim, disability, I can't say it, eligibility, dual medical equipment. I got the flip flops today. End stage renal disease. Make sure you guys know these things, okay? I would again. Let me show you something. Look how many it is. I put them all on index cards. Yeah, I know, Miss Lambert. Y'all take forever. I don't care. Put them on index cards. Remember, we working independently. We ain't getting no student loan. We don't have no tap and pay. We might live in Canada. We might live in Hawaii. We might live in somewhere. Okay. This is YouTube University for medical insurance billing, Sapphire Physician Coding. Okay. And I want you guys to write this down. No student loan, no nothing. And I want y'all to tell me one day who mastered this and who got a job in medical insurance billing. Okay. I want to know. I would like to know. Did you do you tell them what school you went to? You're gonna get a certificate anyway. You're gonna get a certificate anyway. So you guys let me know. I mean, I don't know how coordinated we can get with the YouTube, but absolutely you would get a certificate. If you want to get involved with this class and we want to make it like a real class, I can't do it without you. So I need your participation in this. Um, Right now, we've got the classes stacked. We've got the days, we've got the units on the class, unit as in unit one, two, three, four, five. Right now, you guys are on, I think you're on, what is this, unit 7A. And this is unit 7A because I did the 7 earlier and I cut that video short. So I'm doing another one for you. And at some point, I will be able to do the streams a lot longer. Y'all know I'm watching Twitch, I'm watching this one, I'm watching that one to see how I can do them longer. I do have a podcast. My podcast is more or less political, and we're talking about news and we're talking about different things. The podcast is Lisa Real Talk. Has nothing to do with this. I do have a podcast on here, but I'm going to move it over to my other channel. Um, but in retrospect to this, we have to make this a success. I can't make this a success without you. I need you guys to watch the videos. We need to get up the watch time. Invite your whole family to do it. Okay, this is not something that you need to pay for. We are doing this as a courtesy for everybody who wants to learn about medical insurance billing and coding. Yes, we do have individual courses for you to learn. Those courses are a fee. Go on my website, sapphirecoding.com, and you can look at the courses. Hit the tab that says bookstore. If that thing does not open, call me, and I will show you the courses that we have in one of the tabs here. One of the chats. I did a chat on my bookstore. Okay, so again, just be precarious. I mean, as self-learning takes perseverance from you. Self-learning helps you. I mean, you have millionaires. They teach themselves how to become millionaires. I think you teaching yourself how to do medical insurance billing, how to do coding is what it is. Because when you're taking that test in AAPC, they know whether you've studied or not. It doesn't matter if you went to college. It just doesn't matter. What matters is that you pass that test. If you can pass that exam, you're in. Okay, if you can pass that exam, you're in. Okay, so I have to go on it. I just thought about something. I have to go on it. Okay, so I'll go on there later. Okay, so I'm just kind of scrolling up. This is Medicare we in. Medicare Part A, Part B, Part C, Part D. I want to see if they let us actually go into it. Well, we can. I don't want to take too much of your time. All right, so let's just kind of scroll down. And here's your key abbreviations. I'm going to share this real quick. That's your key abbreviations right here. Make sure you guys get this. You guys should have the book for this, so I'm not going to leave it up too quick. I think I got 30 seconds or 10 seconds or something to put this up. But these are your abbreviations, and I'm going to read some of them out. ABN, APM, CCI. CCI you've heard of already. Corrective Coding Initiative, CMS, Center for Medicaid Services, DHS, Department of Health and Human Services, ERA, ESRD, and Stage Renal Disease, GPCs. I'm not going to read all of them, but I want you to make sure you put them on index cards. There are a lot, okay? So let's move down. Performance objectives. Performance objectives, okay? So again, in this book, we're now looking at the workbook. The ISBN for the workbook is below. I put it at the beginning of the chat again. So I cannot make this work without you. So I don't care if you tell your friends, your aunts, your cousin. This is a free course. This is a free course. You going to college for this makes no sense for $20,000. AAPC, if you can't pass that AAPC CPC exam, it's worthless going to college. If they don't teach you to pass that exam, you can't be a coder with a college degree. It's not going to work. You have to pass the exam. So everything that you get, I don't care whose class you're in on YouTube, whatever you look at on YouTube is going to save you $27,000. I have that true thing that tells you how much it is for medical billing and coding. I don't even know why. If they're not going to certify you, what is the difference? What's your purpose? Okay, oh, because you got to get the financial aid for your books. I'm sorry, but I'd rather pay $200-300 for my books than get a $20,000 loan. So that's why I want you guys to take advantage of this class. I fixed the chats in order. Sapphire ED1, Sapphire ED2, Sapphire ED3. I put the days that we did the chats in case you trinkle away and you go, oh, I want to go back to Miss Lambert's class. I put everything in there in order so you guys can get it. If you have your cousin and say, what class she got? I want to do her class. YouTube, that's all they got to do. They have to subscribe to my YouTube. We need views, guys. The more views we get, the more I can spend time in this. Ice Show Speed showed me how to stay on longer. I'm sorry, I don't know if you know him, but he's like one of the famous guys that does all these kind of crazy things on YouTube. He has like 40 million people on YouTube, and you guys know me. I ask everybody how we do this YouTube. But the main thing is, you guys have to get into the classroom. So I have to have the watch time up, and I can give you more of this. So okay, so let's get back because I'm just running off. Okay, so fill in the blanks. So I'm going to hit this up with you to show you what you're going to do in your workbook to fill in the blanks. Okay, this is what you're going to do to fill in the blanks. I'm just going to read it real quick. Medicare is administered by the federal agency. You got to fill in the blank. Medicare Part A is what? Patients who are entitled to receive Medicare benefits are referred to as, no, I'm not telling you, you got to read that. Okay, I can show you real quick, but that's what you're going to be doing. Okay, so again, we are on Medicare. Medicare is crucial for medical insurance billing. Okay, we're on multiple choice. This is your workbook. This is your workbook that you're working on. I'm just kind of coming in and out of it. The first one, the fee that Medicare decides a medical service is worth is referred to as the what? Multiple choice. Next one, national coverage determination are coverage guidelines that are mandated. So see how you have multiple choice? Most of this book is derived the same way. Okay, so when you get your book, it just takes when you're going to have time to do it. Let's hit up on the true or false real quick just to kind of give you an idea what the true or false has going on. All patients who have Medicare health insurance card have Part B, A, and Part B medical coverage. True or false? So again, that's in your book. And what you're going to do is just set 2 hours aside to yourself. If you forget something of what went on in this chat, you can backtrack on this chat. I named this chat so you guys can just go straight to get this chat if you forget something. If you have a question, always send me a message and we can talk about it. Okay? So let me remove this. Who is this? Oh, okay. Oh, awesome. Very good. Very good. You did I spell that? I don't know what I put there. I forgot the E. Okay. So let's go to the end of this. Okay, so directions, problems, original bill, patients. This is the problem. Mr. Elba, a Medicare patient, went to Medigap insurance. Okay, you're going to do all of that work. That's why I want you to set that aside. So set your time aside so you can have time to do your work. I'm going to drop the book up here again so you guys can see what books we are going to use. Graduating, that's very, very good. Let's see. So these are the books that you're going to use. Your medical insurance billing book, and you're going to use the workbook. Okay? So I'm just going to take them down. And I'm going to put the schedule back up there so you guys can see the schedule. So some of you guys who missed the schedule, I'll go ahead and put the schedule up. So today is Tuesday, and we're going over 5 and 6. So we're going over the workbook, 5 and 6. We've already went over the reading book, 5 and 6. Make sure you have your index cards so that you can retain the information, especially if you're graduating from one school to the next. You can use index cards to help you to retain information. Because if you're graduating, you're going to a higher level of education. So you're going to a higher level of education, you need to have more retaining in your brain, right? So even if you're taking your CPC, that's a higher level of education. You need to have index cards to help you study. Okay, so those of you who are going to the next level of school or going to college, and you're going to be like a an RN, and you need your CPC, it's additional work, and that is just fine because coding managers are mostly registered nurse or utilization review, and yeah, they need their CPC. Okay, so let me just continue to go down. Complete Medicare Advanced Beneficiary Notice non-coverage. So this is a sample that they're giving you. This is a sample of one of the action plans that they're giving you. So remember, in your exercise book, try to do everything. If you can't do everything in your exercise book, it's okay because you can always go back to it. Always go back to it. Again, this is medical insurance billing, and we want you to try to be through with this in 3 weeks. 3 weeks of this, okay? 3 weeks, because the most of your time that you're going to do will be on your coding cases. By the time we get to the coding cases, you should be abreast on billing. That means just kind of know something about billings, know the basics about billing, know the basics about medical terminology. By the time we get to your core courses, you should know ICD-10 and CPT. Okay? So, oh, here I didn't show you some. See, this is what they want you to do. This is one of the exercises in there about your advanced beneficiary notice. Okay, what time is it? 5:28. Okay. So again, remember this is the second chat from the first one that we did a little while ago. I cut it short because I didn't want us to go through the whole thing, and my audio was in a mess. Y'all know what happened before when my audio was in a mess. Okay, so you're also going to do 7 in your workbook, Medicaid and other state insurances. So this is Medicaid and other state insurances. So other state programs. So remember, Medicaid is not an insurance. It's an assisted program. It's not an insurance. It's an assisted program. So you also are going to do this. So remember, you're going to do 5, 6, and 7. Okay. Hi. You're going to do 5, 6, and 7, and this is going to help you. Okay. Remember, if you do not have your book, you're going to go to Kindle and you're going to put that book in, and that book will populate for you here. Right now, I have the ICD-10 up. So remember, because these books are like 100 and change. Okay. And nobody has that money all at one time. Use Kindle for as much as you can, and then when you get the money, you can purchase your books. Okay. I don't know what that was, y'all. Okay, so Medicaid and other state programs. Okay, these are your key terms. These key terms are important, especially if you guys are not going to go all the way to the coding part. Remember these key terms, okay? I'm going to say one or two of them: prior approval, medically needy, Medicaid, Medi-Cal, fiscal agent, federal poverty level, share of cost. These are the things that you need to know that involve a state agency assisted program. And that agency is a federal and state program. So, just kind of be precarious about that, especially if you guys are going to move on to your CPC, okay? All right, so let's move down. Performance objectives, study outline, Medicaid programs, Medicaid eligibility, managed care, review questions, fill in the blank. Oh, this is a good one. Healthcare reform legislation passed in 2010, known as. I'm gonna let you guys see this because this is some of your exercise that you're gonna work on. Okay. So they also have a couple of scenarios in here, and you guys can also do that. Okay. So this session is mainly about getting organized, and getting organized. Sometimes it's hard to get organized when you have a ton of things to do. Okay, I'm pulling this book up again. This is my Kindle. Okay, and I have all of the books in here. I have all of the books in here. I don't know. my grandson. I don't know what he's doing. So here is the book, and I looked at this before. That's why I know you can see this clearly. Okay, it's not a copyright. I mean, this is the books that I need you to use generally. So and if you go on Kindle, you need the workbook for these medical insurance billing, 17th edition. And I like these. I like the ebooks because I can go anywhere and take the ebook. I can go downstairs, I can go outside, or wherever I want to go, I can use the ebook. So that generally is the work. That's the workbook. And like I said, look, remember I was telling you guys about the step by step ebook. No problem. And let me tell you something. If they have the samples in here, why wouldn't you use it? At least until you can get your book. When you can get your books, until then you can get this book. So what you're going to do, I'm going to see if I can pop into thrift.com because you can get books on thrift.com for nothing. This is the mummy has registered with. I don't know what that is. Maybe they don't have it no more. Oh, I can't pull it up. Sometimes you can't pull stuff on different domains. Okay, well, you still can go to Amazon. Amazon is 100 something. Remember, when we get ready to go into CPC, I think I put my schedule up there for you guys to see. Let me see. Because I tried to let y'all see my schedule before. I'm going to drop that off. I don't need to save nothing with that. Okay, because in the schedule, I'm actually going by the regular schedule. I don't know why this is here. We're going to drop this down. I'm actually going by the regular schedule, and I'm giving it mostly to you in different. I'm just giving it to you in different parts and different aspects. Six weekly creative. Okay, so addendum. Okay, so I think I took it down, but when you start Sapphire, the first week you do is really orientation. And then the second week that you do that's when you really start your medical insurance billing. Okay. So when you start medical insurance billing, that's when you go from chapter to chapter. I have some that actually read first and then go do their workbook. But either way, you're still going to make your index cards and you're going to follow the class. Okay. If you get lost, don't worry about it. Send me a message. You're lost. Miss Lambert, where did you say to get those books from? I always try to put a link down there for you guys to get those books. But if you don't see them, again, you can try Amazon to get those books. These are the books that we are working in right now. You guys know I put these books up several times because I want to make sure you have the correct books. And again, they don't have to be the brand new ones. You can get the year before or so. If you go to elsevier.com, you can also get those books for a good price. We always going to stick to the schedule. So today is Tuesday, and we are closing out on 5 and 6. So we did 5 and 6 in the workbook. We also did 5 and 6 in the reading book. Just don't forget that you can look at least the first 100 or so pages in Kindle. I don't know. A lot of people may not have Kindle, but this book is in Kindle. And again, you can look at the first 100 pages, I guess, of Kindle. Because that book is almost 100 and something dollars. And I know sometimes people don't have that much money right away, but that's what you need to work on. Okay. So I'm just going to go back in because I want you guys to get a couple of these out of the workbook. So here is Tricare. Let me see how many we have. Okay, so we're going to work on the workbook. These are for next week. Yeah, because I can see that the workbook that we're going to work on is for next week. Don't forget this week in the workbook, you are doing chapter 6, 7, and 8. 6, 7, and 8. Wait, I forgot 5. 5, 6, 7, and 8. Those are the three that you're doing. Okay. I'm going to pull up Tricare right now. I want you to do the Tricare because you went over. Let's get rid of that. Remove. I want you to do the Tricare because we did go over the Tricare. Remember yesterday in the 5 and 6. You guys go over that video that we did yesterday. Yesterday's video should say Monday. Sapphire ED 6. So we did go over a little bit of that. If you do have your book, then you've already read this. This is the workbook that you will do. Okay, this is the workbook. So, but you've already read these terms. Now it's time for you to do practice. So you guys know when I say practice and theory, the theory is reading, the practice is you doing the exercises. Okay, transitional assistance management program, Tricare, service benefit program, prime service area, okay? Key abbreviations, ADSM, campus, Champ VA, COB, DEERS, EOB. DEERS, they do the EOBs for service members. PSA, POS, PCM. PCM is the same as our primary care provider, okay? Performance objectives. Okay, here it is right here. I got to show you guys this. So this line right here, this is the study line. This is what you're studying in this book. Okay, that's what you're studying. That's going to help you get to the next level. Once you finish the medical insurance billing, you'll have time to go over the medical insurance billing before I move on to medical terminology. So I'm not gonna just go like 1 week and then we're gonna boom, we're jumping right in. I want to give you guys a little bit of time, so maybe maybe a couple of days. During that time span, I will be backtracking. So I think what I'm gonna do is once we finish this, next week should be good. We close to finishing the reading portion. Um, the workbook does have about 20 something chapters in there. Let's look and see. The workbook actually has 21 chapters in there. We're not doing the seeking job thing. I mean, if y'all want to do that, y'all can, but we're not really going to do that part. Chapter 22 is about procedures in medicine and diagnostic coding. So this is like extra stuff right here, tests that you have right here. And actually, I think this is good because they didn't have this in the other books. They have this now, and they got a couple of cases in there that you actually can look at. So I'm gonna show you this real quick. So some of y'all kind of want to test out, your knowledge. You want to see if you really want to do coding. You want to see if you want to, participate in that program. Dr. Input sees a new patient, Miss Post, in the office for acute abdominal distress. The physician spends approximately 1 hour obtaining a medically appropriate history and physical examination with high complexity decision making. Oh man, let me tell you something. When we get to this, and I'll show you guys how to do those reports on those intake sheets. I'm gonna show you 97 and what's the other one? 98. Whatever it is, we're gonna get to that. But you guys see that I got to remove it. Been up there too long. So you guys see these little bit of cases that's in the back of this book right here. I don't remember that in the older books. I mean, that's something new that they put in there. So I mean, by all means, if you can get these new books, that's fine. That would be good. That's why I said, if you can just take that hour out and just follow me along. So let's say you get out of work let's say you get out at 5 o'clock. By the time you get home at 6, I've probably already started, or I've done an archive and I've put it in there. I like the live because it gives you guys a chance to just talk to me if you want to, if you're actually there. If you're not there, you can always archive and you guys can send me a message. So that's why I kind of like to do the live. But if there's at any point that I can't, I'm going to do the video and Zoom, and then I'll go ahead and upload it. But as far as the medical insurance billing book, you getting this is your key to knowing about medical insurance billing. If you want to know what medical insurance billing is, what trade is coding, what is providers services and things like that, then you want to get the medical billing and coding Q&A book. If you get that medical billing and coding and Q&A book, you should be good. Let me go on here. The medical billing and coding and Q&A book is a book for you It's for people who've never done medical insurance billing before. Okay. And that's kind of hard for people who haven't done medical insurance billing before. I don't know what this is right here. Um, when you haven't done it before, it's hard. But if you read on it, I'm trying to get in here so I can show you the book that I want to show you. And for some reason I can't get in here. But let me see if I can get it another way. When you want to know about medical insurance billing, that's the seller. I don't want that. When you want to know about medical insurance billing, and you don't want to spend $100 on trying to find out about the medical insurance billing, go get the medical insurance billing Q&A book. The book is also in my chat. I have people who email me and they want to purchase the book. You can purchase the book if you want to. Go to sapphirecoding.com or go to amazon.com. You go to amazon.com, you can look for my name, Lisa Lambert, and you will find the books that I've already written in regards to medical billing and coding. Or you can go in there and just tap in Sapphire Physician Coding, and all of my books will pop up, okay? What I'm looking for right now is I'm trying to see if I have the copy of the cover of the book. I have. Let me see if this book pops up how I want it. This book that I'm getting ready to show you now. This is the book that's in the Sapphire class. It is the same. It is the same language of medicine. This book is still $112. That's the book. If you join the Sapphire class, that's the book that you will get, and the book is free. It comes with you. It comes with your course, okay? And it is the same as the books that we already have. These type of I don't know if I can show that. Okay, I can show this. These type of illustrations that are in there. These are the illustrations that I was telling you guys about that I want you to kind of take heed on, because on your CPC, you might have stuff like this. And the CPC will ask you, what's in the cerebrum? Or where is the cerebrum? Or where is the back of the forehead or something like that? So these things are pretty much crucial. And, again, this is the book. You get this book free in my classroom. And it's the same book. Okay? It's the same book. I just wanted to pull that one up. But as far as your study time, I mean, this little portion right here that I'm doing, I want you guys to make sure that you have study time, because if you don't make a study time for yourself, you won't be able to retain this stuff. You won't be able to retain it. Like I said, when you come home from work, set 2 hours aside so that you can study. Set 2 hours aside. Okay, hold on. Medical terminology, medical billing book. Medical billing book Q&A. So this is one. This looks like an older book. This is a book. This is an older medical insurance billing book that I written. I don't know, probably 10 years ago. Yeah, this was a little old, but I mean, it's all the same. It has all the same stuff in there. Okay, and it's generally for you guys to get to know medical insurance billing, and it's for people who have not been practicing medical insurance billing. So I'm just popping up stuff because I'm on my iPad. This is my attendance protocol. Okay, this is my attendance protocol. As you are a student. Okay, I'm gonna say Sapphire, even though this is for you guys for YouTube University. Okay, as you are a student at the School of Sapphire Physician Coding e-learning, your attendance must be submitted. YouTube can't submit attendance, but when you guys come in, just do your work. I know when you're in, I can see people coming in and out. I can't take attendance on YouTube, but this is for people who are paying. That's for my class. Logging into the Sapphire Teams portal automatically takes your attendance. So this is for my Sapphire students. If you guys are in here, I'm just going through this real quick. Utilizing extra messages to assure all your work, time, and participation is counted. So when you guys come in, talking about the YouTube, when the YouTube people come in and we're working on, let me share my screen real quick, and we're working on the workbook. I know, like somebody comes in and say, "Hi, I know you're in here." Like advocates, I know he's in there. because he's saying hi to me. When you guys come in, you can say hello or hi, and that's it. And I know that you're in there. Um, and at least we can, get some kind of a communication going, which would be great. You guys can give me a couple of more messages. I love when you guys leave me the messages and the little community thing. So that's pretty good. Okay. So I'm going to show you one or two more of these things right here. These things. These are actual cases. This is similar to what you might see on your CPC. Once you get your ICD-10, we will start doing that. We will start doing that. We're just looking at this because your class is generally over. The chapters that we did was fairly quick. So I'm just going to kind of backtrack on the chapters that you're going to do. We just kind of went over that 22 because it was all the way down at the end. But again, that's extra work for you. So we went over the blue plans, private insurance, and managed care plans. Okay? That's what you're going to go over. So this is for YouTube. This is your homework. 5, this is in the exercise book. Okay? That's for the YouTube students. We went over that, right? And we're going to go over key terms, key abbreviations, performance objectives, student outline. Okay? Assignments, review questions, assignments obtaining authorization, assignments obtaining authorization for physical therapy, assignments obtaining authorization for diagnostic arthroscopy, assignments obtaining authorization for consultation for managed care plan, assignment obtaining authorization for diagnosis body scan from a managed care plan. So that is your exercise homework that you're going to do. I'm not finished. I just did that chapter. Okay, so let's look at what else you're going to do. Chapter 6. Chapter 6, guys. So, chapter 6 is Medicare. Remember, we just did the Medicare. I'm going to show you this real quick. We just did the Medicare. I'm just going over what your exercises in, okay, team? Just going over what your exercises is. Okay, so again, chapter 6, same thing, key terms. Okay, abbreviations, performance objectives, study outline. You guys notice the pattern here. Your exercises is pretty much the same thing. Let's start talking about the assignments. Assignments, calculate mathematical problem. Let me see this right here. Oh, well, this has to do with calculation of uncertain how much of the following Medicare scenarios. You remember I told you about the RBUs? We're going to talk about the RBUs soon, okay? But you have that in your medical insurance book. Go over that because we're going to go over that again in your CPC guide, okay? Assignment, complete a Medicare advanced beneficiary notice of non-coverage. Let me get this up for you guys. So I'm gonna scroll down so I can show you this. It's only gonna be a quick 2 seconds. So advanced beneficiary notice. This is an exercise that you guys are gonna do. See, I just want to show you this because this is the whole thing right here. Okay, when you're in a doctor's office, you should have this, and yes, you should be familiar with this when you're in a doctor's office. Okay, so we're finishing 6. Okay, let's go to 7 because remember you're doing 5, 6, 7, and 8. Medicaid and other state programs. You're going to do your key terms. Remember, I showed you the key terms. You're going to do your key abbreviations, performance objectives, study outline. Now we get into your assignments. Okay, so this is pretty much, before you get to your assignments, you've already studied what you're going to do your assignments on. So assignment 7.1, review questions. Assignment 7.2, critical thinking. Okay, you see how quickly that was? That one is already finished. So this one is not really that bad. In most states, the medical assistant program is known as Medicaid. However, some states may have different names for the program. In California, the program is called, you're going to answer that. Okay, your critical thinking, scenario 1, scenario 2. Okay, let's go to chapter 8. We're just kind of backtracking in what you're doing for your exercise. So Tricare and Veterans Health, I'm going to let you see that one real quick. That's your exercise, okay? So in that, same thing you're going to do. Your key terms, abbreviations, performance, outline. 8.1, review questions. 8.2, critical thinking. And that's it. Tricare and Medicare is finished. Let me just make sure I got that down. Okay. We're not doing 9. We're only doing 7 and 8. So hold on. Yeah, that's it. Okay. 9 will be for next week. I have not put that schedule up. Let me just put that down real quick before I forget. Okay, hold on. 9. So 9 in the workbook, the 9 to 10, 9 goes all the way down to 22. So on this schedule, what do I have in here? Friday, 7, 8. Oh, I have it in here already. Okay, so because the workbook is a little bit different than your reading book. That's why this looks like this. Well, that's not why it looks like that, but that's how your reading book is. Your workbook is a little bit different. That's why I give you 4 exercises with your workbook. So your workbook for it's already 5:55. Your homework with your workbook is going to be 5, 6, 7, and 8. Okay, 5, 6, 7, and 8. So make sure you get that done. Um, so today is Tuesday. You guys, we don't have class again until Friday. I may do that chat ahead of time. Um, but as far as now, so you don't get kind of backlogged into doing stuff. I think you guys are okay with the reading. Like I said, when you do the exercise, if you can do both at the same time, it's okay. And I think 2 hours is good because I'm trying to figure out and make sure you fit all your work in. If we're doing this for an hour and then you do your hour of your work, you should be okay. I would prefer you do at least 3 hours, like an hour here and then let me take this down. An hour with the class and then spend 2 hours on your work. If you do Monday 2 hours, Friday, because today is an off day. Today is not really one of your work days. I mistakenly put this on your schedule from last week, so I had to do it today. Um, so your regular schedule is Monday, Friday, and Saturday. Monday, Friday, and Saturday. Monday, Friday, and Saturday. That's it. This is me and you one on one. This is me and you. This is a live chat right here, or even if it's video. This is the time that I will do the chat. Okay, and then you should do 2 hours worth of work. So it's really 3 hours worth of class that you're doing. Um, and just remember, the workbook is different. The workbook is different. I just saw a lot of stuff in there that didn't coincide with your reading book. It didn't quite coincide with your reading book. Um, I just want to look in here at this one. This is the regular book. So if we go in here and we're looking at the chapters, there's so much stuff in it. There's so much. Wait, hold on. I don't know why, but this book looks like it has much more stuff in it. Y'all want to see Linda? I know, genius. Channel. Gee, tell you something. These women are so smart. Do you see these women and they spitting out these words in here? You'd be so surprised. But what I'm looking for is to make sure that you have all of your managed care in here. This is your book in here, and I'm trying to make sure that the Kindle book is the same as the book that we have, and it is. It is. But your workbook, like I said, your workbook, the workbook is a little bit more tangible. Hold on. Let me see if you can see this. If I can put this up, I want to see. Okay, what I'm doing is I'm closing, and then I'm closing again. I'm closing. What do you call it? Folding chapters in. Hold on. All right. Let's fold this one because we went over them. That's why I still have them all open. I'm closing them down so you can see them. Okay, so I'm gonna click on 5 because we kind of backtracked on 5. Let me go right here. So you guys remember. Let me put up. Okay, so you guys remember this is the workbook. It's tiny, you can't see it, but when you get your workbook, you will see it. So 5, we went over 5, 6, 7, and 8. That's what you should be working on, okay? You should be working on 5, 6, 7, and 8. This is the workbook. This is not your reading book. Totally different. You want your reading book here, you want your workbook here. So I'm expecting you to do 4 chapters, okay? 4 chapters. And that's because We don't meet again until Friday. We don't meet again until Friday. Okay. So, just set your time aside for you to do that. Even if you have to go into the weekend, we will still be on that sector. I'm sorry. Let me look at this. Let me look at this one more time. All right. So the workbook that we just did, we went over the 5, 6, 7, 5, 6, 7, and 8. Yeah, 5, 6, 7, and 8. And then Friday, you see, this is not the workbook. This is the reading book. This is what you're going over in the reading book. So what I think maybe I should do, maybe I should make a separate schedule for the workbook, because I need to make sure you guys are keeping up with the workbook, because the workbook is set a little bit different than this one. So let me see. We said 8, 9, 5, 6, 7, and 8. I'm gonna put that below of what you're supposed to be doing. Okay, this is over. I'm gonna put those chapters below in the workbook that you should be doing. Okay, so that's where you should be. Okay, let me let this go. Wait a minute. I'm telling you, I don't know which one. Okay, so we did get through this chat. I'm going to put this down. If you guys stick with me and you want to go on sapphirecoding.com and use this key code, hashtag key 212, that takes off $1,150 off of those things, off of those courses. If you want to get them with me, that's fine. If you get them with me, I'll give you even more discount. Bye.